On the 1st of March 2022, the National Health Insurance Authority started the onboarding of core members into the scheme under the Group Individual and Family Social Health Insurance Program, GIFSHIP of the NHIA, through a special window known as GIFSHIP-n. Through this window, core members can have access to affordable health care during their mandatory one-year youth service to the nation. In this episode, we will be looking at the product known as GIFSHIP-n, its impact on the well-being of core members, and how far it has come since March 2022. Welcome to Easy Access to Healthcare for All, a program that brings you updates on the activities and happenings around the National Health Insurance Authority and the health insurance space at large. My name is Aisha Mohammed Ahmed, your anchor. I will be back shortly with details about GIFSHIP-n as well as news around the NHIA. Keep watching.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We're really enjoying it.
We appreciate their effort.
Welcome back. Easy Access to Healthcare for All kicks off with a news segment. In our lineup, NHIA inaugurates committees on the innovative financing and mandatory health insurance. These and more stories coming your way shortly.
If we are talking about donor financing, you always...
The National Health Insurance Authority, NHIA, in its continued efforts towards designing a workable framework for achieving universal health coverage in Nigeria, recently inaugurated two committees for the integration, promotion, and regulation of the NHIA law. The committees are Mandatory Health Insurance and that of Innovative Financing. They were inaugurated by the Director General of the NHIA, Professor Mohammed Sambo. Speaking during the inauguration, the Director General explained that to have a sustainable law driving health insurance in Nigeria, certain areas must be critically looked at. Hence, the need for both committees.
The second committee, which is on innovative financing, is very, very critical to us in the sense that Nigeria President Muhammadu Buhari, GCFR, has assented into the mandatory this law, and in the law there is a provision of what is called vulnerable group funds. Two things are very critical for attainment of universal health coverage. Number one, you must have a law that will make health insurance mandatory. Number two, you must provide for the coverage of the vulnerable segment of the population, because this segment of the population are grappling with 3 square meal, and therefore they cannot invest their resources for any future endeavor.
The Director General also presented a lead paper on innovative financing and mandatory health insurance to serve as a guide to the committees.
There are 3 major functions of healthcare financing. Number 1, revenue mobilization. Number 2, revenue pooling. Number 3, expenditure allocation and tracking. By revenue mobilization, we are talking about mechanism of raising adequate funds in an efficient and equitable and sustainable manner.
Reactions and inputs to the presentation were made by members of the committees.
I need for us to make this a deliberate intervention. We cannot go far with what we are asking if we do not ensure that people-driven advocacy is put into it.
Pushing should not be a problem this time around. Whoever is coming in, if we need to go on our knees to say, look, whatever it is, some people have been working proactively before you're coming in. Take this document from us and let us implement for the good of Nigerians.
The Director General disclosed that the committee will work within a period of 4 weeks to present a draft to the NHIA, which will be presented to the Federal Executive Council. The aim is to aid a seamless implementation of the new NHIA Act. The Executive Secretary, Pension Transitional Arrangement Directorate (PTAD), Dr. Chioma Ejikeme has led a delegation from the Directorate on a courtesy visit to the Director General of the National Health Insurance Authority, Professor Mohammed Sambo. The visit was to seek out ways of collaborating with the authority for inclusion of the vulnerable group, especially pensioners, into the National Health Insurance Authority. The Executive Secretary, while speaking, mentioned that retirees are in dire need of health coverage, but most times lack the means to afford good health care. She said that the Directorate is ready and will work with the NHIA to ensure that health coverage reaches the vulnerable, especially pensioners.
The issue of providing health insurance for older persons in Nigeria is an issue that shouldn't be negotiable. Nigeria has to have some social services for older persons to be able to take care of them the way we have in other developed countries of the world. We are grateful to have been asked to be part of the Ministerial Committee on provision of health insurance for older persons. We are aware of the National Health Insurance Act that was signed into law last year, 2022. And we're here to find out how PTAD can be part of this whole system.
Director General of the NHIA, who received the guests, said that the provision of subsidized healthcare for the vulnerable is one of the priorities of the NHIA. He added that the authority will work with PTAD to ensure that retirees are covered in the new NHIA.
We can work together to ensure that even before the full operationalization of the new Health Insurance Act, we can begin to do something. In fact, there is a budget line in 2022 for retirees in this national health insurance. The budget is small, but the most important thing is that budget line is created. So I think what we need to do as a strategy to ensure that that budget is fully populated for the agent, we can work together.
He also noted that both PTAD and the NHIA will engage in joint advocacy so that retirees with low pension can still benefit from the scheme.
Welcome back. The program is Easy Access to Healthcare for All. The Group Individual and Family Social Health Insurance Program, GIFSHIP, is the program of the National Health Insurance Authority designed to enhance coverage. The NYSC GIFSHIP, otherwise called GIFSHIP-n, is designed to cover pre-orientation, orientation, primary assignment, and terminal leave periods of the service year of the core members. In our segment, Issues Around the NHIA, we shall bring you insight into the GIFSHIP-n and how far it has come since March 2022 when it was flagged off. Please stay tuned.
The GIFSHIP program is a flagship program of the National Health Insurance Authority. It was formally launched on the 26th of November 2020 by the Minister of Health, Dr. Osagie Ohenere. The major objective of the program is to rapidly expand the scope of health coverage in the urgent quest by Nigerian government to attain universal health coverage. In line with this major strategy of ensuring effective coverage for more Nigerians, the NHIA further created different programs under GIFSHIP that will onboard different categories of people, one of which was GIFSHIP-n for the National Youth Service Corps. The GIFSHIP-n program is designed to provide health insurance cover for National Youth Corps members so that all serving corps members can have access to adequate and quality healthcare services. Dr. Eke Jonathan, General Manager, Formal Sector, NHIA, speaks more on the GIFSHIP-n.
In 2016, 3 corps members died. One in, I think, Kano, Bayelsa, and was it in, yeah. So when the corps members died and the issue was raised, Mr. President directed that corps members should be covered under the NHIS then. So, and immediately a technical working group was set up by the minister. And that technical working group worked, which had included people from the Federal Ministry of Health, from the Federal Ministry of Finance, from NYSC, from a lot of different. So we worked and eventually developed a framework for the implementation. And that framework guided us in doing the costing. Because then we adopted, then we had what we call the VCSHIP, Voluntary Contributor Social Health Insurance, which later they changed it to Vital Health Insurance, and now GIFSHIP. That's you see the trajectory of all this.
He also shares some highlights of GIFSHIP-n program within the NHIA framework aimed at bringing SACA with the core members.
We had to modify the program essentially to suit these children, because the NYSC told us that they used to give them everything. And you know, under the insurance system, there's no insurance system that can give you everything, because these are things that you have to really cost and pay for. So, but what we have tried as much as possible to give them a very, very comprehensive package of care within the frame of the NHIS benefit package.
He speaks further on the features of the GIFSHIP-n and how it is structured to accommodate details of core members across the country.
Once your NYSC gives you a deployment, they give us the list of all the deployed core members, and we generate an NHIA number for them. That's the number we are going to cover. So if whether you are married or not married, you are going to be taken care of. But you, as a person, you're going to be taken care of. But if in the course of your service, you get pregnant, the system will take care of you. You deliver, the system will take care of you. Up to. You understand? But except those who are pregnant before coming to camp, a lot of them, if you get pregnant when you enter the camp, that means you deliver in 9 months. It's even the commencement of cover. Immediately they deploy you, even if you are traveling from your home, and once you have your NYSC number, and you have an accident, we take care of you. Once they deploy you, we will take care of you.
Since its launch a year ago, how has GIFSHIP-n fared? Dr. Eke Jonathan gives an update.
The NYSC program, for me, has been a very, very good program we've been implemented. It's a program that when we started, we were, you know these core members now, we were afraid because these guys are on social media before they will go and say this, say that. But I can tell you that in the implementation of this program, it's been a great work. And even the core members are very happy. Those that have had contact with the health system through this program are very, very happy about that.
Omotade Ayodele Folorunsho is the Director of Core Welfare and Health Services, National Youth Service Corps. Omotade gives us a recap of the program so far as it relates to the NYSC.
I must say, to God be all the glory, because the journey since that time that led to the signing of an MOU between NHIA and NYSC actually kickstarted this engagement. And by March 2022, the journey started.
Omotade speaks on what core members' healthcare situation used to be before the commencement of the GIFSHIP-n program under the NHIA.
It's not been easy. I must let you know that it's been a misgrilled of very many occurrences, some palatable, some very, very unpalatable in terms of attending to medical issues and care of core members. I must let you know that on one part, the core members themselves, there are some that who will not even venture going to hospital when they have medical issues until it becomes complicated matters that could not be easily resolved. God has always been on our side. On issues like that, some will make it, they will come back, but that is not without covering out a huge sums of money to take care of such. There are some for fear of spending, they will not even want to attend to their health at all. In other words, they prefer to stay, indoors, but not even telling people. There are some on one side that they will not even disclose their medical status until it becomes an issue. So when you aggregate all these issues together, the entire thing comes on the lap of NYSC in terms of having to grapple with the challenges of taking care of their health on one side, and some maybe that probably result in an unfortunate death, has a way of impacting negatively on the scheme's public image.
But has the GIFSHIP-n made any impact on the well-being of the core members? What relief has it brought to the leadership of NYSC as well as Nigerians in general? Omotade explains this and other impact the scheme has made.
One, we have improved awareness on the part of core members on the need for them to access medical care, orthodox medical care. Some will tell you they are at home, casting and binding and loosing spirits that do not even exist in the first place. All will have required intelligently to do is to take yourself to hospital and access medical care. So there is a general awareness among these youths. Teeming population of core members coming on board NYC every year, because since we started, is a compulsory requirement that you must enlist on the NHIS before your entire registration can fall through. So on the part of core members, general awareness, then on the part of management of NYC, is a huge burden lifted off the shoulder of NYC. Because I can tell you here, this is my second missionary journey as the director of core welfare health services. So at my first coming here, I marvel at the huge amount of money we incur on medical reforms, taking care of emergencies at the hospitals, and of course, we are a human organization dealing with human beings. Most of these ailments, most of the times, some of them, they were not incidental to service. They came from home. But because these people have been enlisted on national service, you cannot look the other way when they are sick.
Welcome back from that break. Easy access to healthcare for all continues with our stakeholders segment. Today on this segment, we'll bring you testimonials of core members who have taken advantage of GIFSHIP-n under the health insurance program. Joseph Oganifa, a serving core member in the Federal Capital Territory, shares his testimony under the program.
I have accessed care at bio hospitals and maternity. It was an amazing experience. I had my I was sick and I was not having cash on me, so I needed to. Yeah, I remembered at the camp we were orientated on NHIS, so I decided to go to my dashboard and copy my NHIS number. Checked around for hospitals that are NHIS accredited, and I saw that one. So that fateful Thursday, I went there very down, and when I got there, the front desk officer attended to me very nicely. All she needed to do was ask me of my NHIS number, my HMO, which is Zuma Health, and they called them for approval codes.
Another core member, Chude Cynthia Chizoba, also shares her testimony.
I just paid 10% of it. That is 10 because of the drug I acquired, and the drug was just 2,250. And they said I should just pay 10% of it, which was 250, and they gave me drug.
Ibilo Victor says he has also benefited from GIFSHIP-n under the NHIA when he visited his healthcare provider.
I'm here to testify that I've benefited from GIFSHIP-n NHIS at Worcester District Hospital. So when I got there, I was directed to the admin where I could get my own hospital, my own card. So on getting the card, I was directed to a doctor where I told the doctor everything I was going through. So the doctor actually prescribed some tests, lab tests on me. So they ran the test, and I came back in a few days' time to get the results, and then drugs were prescribed to me. I also had tooth extraction there as well. I was also given drugs for free, and that's it.
Sale Likita expresses his excitement over the program after accessing care.
My experience was very nice. I enjoy it. I have never got something like this before. I think this is my first time of benefiting from government setting something like this, and it was very good for me. That side is not something I can say much, but I am very happy that I have achieved and got something from the NHIS. I just pray that their service will be improved so that we should have things to say more better than this.
Joel Francis also called on core members to take advantage of the GIFSHIP-n program.
I would like all my core members to take this very opportunity, because I'm just imagining myself serving in Abuja, I don't have anybody here, and I fell ill. I will not go to another hospital to spend some money. So I want to just encourage all my core members to be part of NHIS.
We will now take your questions in our last segment of the program.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled?
How can I get enrolled?
Question: can an enrollee access healthcare services outside his or her state?
We have a list of accredited healthcare facilities all over Nigeria, and you are entitled to, as a referral case, you could be referred from Abuja to access care outside Abuja. You could be referred to any hospital with the adequate skills, manpower, and equipment to treat you in any part of Nigeria. But again, at primary level of care, you are restricted to one facility. And that facility is what we call your primary healthcare provider. So you are registered with healthcare with that particular hospital or health center, and you are to go there to access care at the primary care. That hospital is capable of referring you, like I said earlier, to any other hospital.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled?
How can I get enrolled?
This, we come to the end of today's episode of Easy Access to Healthcare for All. Please join us next week, same time and on the same station for more on the strides of the National Health Insurance Authority. You too can take advantage of the GIFSHIP program to enjoy accessible and affordable healthcare. Have a good evening.